Okay, so good evening. This is part two of our discussion of the integumentary system. So we have finished the first part, no, of the discussion. So this is the second and last part, and we will start with skin cancer. Okay, skin cancer is the most common cancer, no, worldwide, and it is mainly caused by exposure to ultraviolet rays. And as we all know, the most common source, no, of ultraviolet rays is the sun. So therefore, no, it is really excessive sun exposure that leads to uh, uh, cancer, no, development. Especially, wait lang tanggalin ko lang itong, iba to, paano ba ito tatanggalin? Especially among fair-skinned people. No? It is the fair-skinned people that are more prone to developing skin cancer because they have less amount of melanin in their skin. Yes, it is melanin that provides protection against UV light. Okay, so therefore, it is dark-skinned people, no? Ah, ang ang have more protection, no, against UV light. Okay? No. So, among fair-skinned people, it is prevented by limiting exposure to the sun. Wait lang, I will just have my pointer. Ayan. By limiting exposure to the sun and using sunscreens. And we generally have two types of ultraviolet rays, yung A and B. Oh, that's why you have your UVA and UVB. UVA causes tanning, no? And it is usually associated with uh, a type of skin cancer called malignant melanoma. We will discuss the details of that later. And then the second type of ultraviolet rays is UVB. It's the one that causes sunburns naman. Ah, okay. And that is the reason why, when buying sunscreens, no, or sunblocks, no, you should take time to take a look at the label, no. The sunblocks that you should be buying, no, should both block UVA and UVB rays, in order to ensure that, no, you do not just prevent sunburns, but also, no, you are also protected from getting skin cancer. And we have three types, no, of skin cancer. You have what you call your basal cell carcinoma, squamous cell carcinoma, and your malignant melanoma. Ah, basal cell, by the way, here is their picture. Here is the physical appearance of a basal cell carcinoma. So as you can see, no, it just looks like an innocent pimple. Oh, common sa face ang basal cell carcinoma. Ah? And this is a squamous cell carcinoma. Oh, it's like a wound, no, that is already in its healing phase. Kumbaga, yan, parang may scab. And this is a malignant melanoma. Ah? Okay, so isahin natin ulit. So basal cell carcinoma is so named because, no, it affects cells in the stratum basale. And among those three types of skin cancer, it is the basal cell carcinoma that has the best prognosis, because it can be easily removed by surgery. Oh. In fact, there are Hollywood celebrities, no, who reportedly had this kind of skin cancer, and they have survived it because, again, it can be easily removed by surgery. One very good example is uh, si Robert Downey Jr., no? Si Iron Man. Hmm? Okay, no? A couple of years ago, he was reportedly, no, had, no, a basal cell carcinoma on his nose. Okay, and apparently he thought that it was just a pimple, o kaya lang tumagal for several weeks, hindi nawawala yung pimple. And after consulting with his primary physician, they found out that again, it was a basal cell carcinoma. And it was removed by surgery. Now the second type is your squamous cell carcinoma. Uh, ito naman is located above the stratum basale. It has a poorer prognosis as compared to basal cell carcinoma because it can cause death. Okay? Now, the third type of skin cancer is a rare type, but it is the most dreaded type of skin cancer. Ah, ah, because aside from it can cause death, it is the one that easily metastasize, no? Mabilis kumalat. From the skin, it can spread to other tissues in the body. And that spread of cancer is called metastasis. So talagang delikado kapag malignant melanoma. And it's called melanoma because it arises from the melanocytes that is found in a mole. Di ba? No? Oh, a mole is pigmented because it is a spot in the skin where there is concentration of melanocytes. Therefore, it is pigmented because of the concentration of melanin. That is the reason why ibig sabihin, ang mga moles pwede talagang mag-develop into cancer, lalo na if it is located in the area of the body where it is frequently irritated. That is why if it is located in those areas, doctors advise to have it removed surgically. Okay? And the American Cancer Society, ito yung itsura ng actually. Kaya hindi naman lahat ng mole that can develop into cancer. Actually, the American Cancer Society developed a mnemonic in order for people to easily identify those moles that are at risk of developing skin cancer. O baka kaya naman, baka nga nagsisimula na siyang skin cancer. So they developed this mnemonic in order to guide the people. Okay? So that if these mnemonics satisfy the characteristics of a particular mole that is located or found by the patient in their body, they will have to consult their primary care physician. So ano yung apat na criteria na yan? A for asymmetry, no? B for border, C for color, and D for diameter. Ang malignant melanoma daw, unlike an ordinary mole, malignant melanomas have asymmetric shape. Asymmetric naman talaga to. When you say asymmetric, when you draw a line dividing the the pigmented spot into two halves, asymmetric, kita mo yung kalahati iba yung shape sa kalahati. Unlike a mole, most of the time a mole is round, it tends to be symmetric rather. And then B for border, as in irregular border. Just like what you're seeing there in the picture. The border of that malignant melanoma is obviously irregular. And then C for color. A malignant melanoma have different shades of color within that area of pigmented spot. So as you can see, in this area, you have a lighter color. Pagdating dito, you have a darker color surrounded by an area that is lighter. Tapos dito, darker na naman. Unlike an ordinary mole wherein in all of its parts, it basically has the same shade of color. And lastly, diameter. If the diameter is greater than the diameter of a pencil eraser, a standard pencil eraser, yung Mongol, yun ang sukatan doon, it most probably is a malignant melanoma. So tandaan niyo yung acronym na ABCD as devised by the American Cancer Society. Now, so natapos na natin yung skin cancer, no? And in the first part of our discussion, we will also be able to describe the epidermis and the dermis. Natapos na natin yun dun, no, sa first part. So, let's now go to the tissue right beneath the skin. And it is called the subcutaneous tissue. It is the connective tissue where our skin is attached. No? Again, it's called the subcutaneous tissue. You have to remember, it's not or no longer part of the skin. Although sometimes it's called the hypodermis, no, it's not part of the skin. It attaches the skin to the underlying bones and muscles and supplies it with blood vessels and nerves. And as we have said in the introduction, no, dun sa ating brief overview, the subcutaneous tissue is a loose connective tissue, no, which includes adipose, which contains about half of the body's stored fats or lipids. Okay? Now, syempre, the amount and location of adipose tissue vary with age, no, sex, and diet. Di ba? As we grow old, no, yung location ng adipose tissue natin nababago, especially between males and females. That's what you mean by sex. Sa mga lalaki, ang adipose tissue is more concentrated in the tummy, no, or in the abdomen. Kaya pag mataba, malalaki yung tiyan. No? While among females, the adipose tissue is concentrated on the upper thorax and then in the pelvis. That is the reason why, no, females have distinct shape from males. Ang katawan ng mga babae, pear shape, or yung sabi nga nila, Coca-Cola. It's because of the location of adipose tissue. No? Aside from providing the shape, no, of the body, adipose tissues in the subcutaneous functions are padding, no, and insulation of the body. And it is also used to estimate our total body fat. No? Ginagamit yan. No? Okay? No, aside from computing your body mass index, no, yung subcutaneous tissue, pwede mong magamit sa pag-estimate ng total body fats. Okay? So we're finished with subcutaneous tissue. So again, the skin has two main layers, the epidermis and the dermis, and right beneath that is a subcutaneous tissue that attaches the skin to the underlying muscles and bones and also supplying it with blood vessels. Now, let us go to the accessory structures, no, associated with our skin. And the first accessory structure that we will be discussing is hair. Now, hair is found everywhere in the human body, in the human skin. But there are areas of the body that has totally no hair, like the palms and soles, the palms of the hand and the soles of the foot. Our lips, the nipples, some parts of the genitalia, and the distal segments of the fingers and toes. Because in those areas of the body, we do not have follicles. Because hair arises from a hair follicle. That is your hair follicle. Walang walang hair follicle in those parts of the body that we have mentioned. So what is a hair follicle? It is an invagination of the epidermis that extends deep into the dermis. Di ba? Makikita nyo, sa epidermis, there's an invagination Pero, ayan, nag-extend hanggang dun sa dermis. So technically, no? Technically, the 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 hair follicle, no? Okay? In terms of its anatomical structure, it is an extension of the epidermis, no? It is just found in the dermis. Okay? Okay. Now, so the hair follicle, no, since it is located deep into the dermis, no, it is the part of the hair that we cannot see, that we do not see. Ang nakikita natin, no, is the part of the hair that emerges from the surface or that protrudes from the surface, the hair shaft, no? Oh, ano yung nasa ilalim, no? Ano yung nasa loob ng hair follicle? It's the root, which is also not seen, and the hair bulb, which is the expanded base of the root. Okay? Now, Now, the hair is also divided into two layers. No? The hard outer layer known as the cortex, while the inner softer center known as the medulla. Ah? Now, that outer cortex is still covered, no, with overlapping cells called the cuticle. And it is the cuticle that holds the hair into your follicle. Now, in terms of hair production, no, kaya nga tumutubo ang buhok natin, humahaba siya because it is continuously produced. The question is where? It is continuously produced in the hair bulb. Okay? Ito yung sinasabi nating hair bulb. Ayan. No? And the hair bulb rests on the hair papilla. And this is your hair papilla. Okay? No? It is an extension of the dermis. So the hair papilla is part of the dermis that protrudes into the hair bulb, and it is the one that contains the blood vessel. So meaning blood supply, no, is important, no, for our hair to grow. Importante yung blood supply for continuous growth of hair. Deprivation, deprivation of enough blood supply, no, in our hair bulb will result to hair fall. Kaya nga, 'di ba, there are shampoo, no, for the management of hair fall para sa mga nakakalbo. I don't know if you're familiar with that shampoo, yung minoxidil, Yung minoxidil na 'yon, its main action is that it causes dilation of the blood vessels in our scalp in order to enhance the blood flow into our scalp. Okay? Yun ang ginagawa ng minoxidil, no? So, resulting to improved, no, delivery of nutrients to our hair bulb, to our hair follicle, thereby improving, no, the growth of our hair. Now, there is what we call the cycle, no, of hair growth. The cycle of hair growth is divided into two stages: the growth stage and the resting stage. During the growth stage, hair is formed within the hair bulb. Okay? So during the growth stage, time na humahaba ang buhok natin. Pero, okay, hindi tuloy-tuloy yan, yung paghaba, because there is what we call the resting stage. Pero, no, you have to remember also, no, that not all of the hairs in the body simultaneously undergo. For example, pag nasa growth stage, yung isa growth stage na lahat. Nasa resting stage, yung isa resting stage na lahat. Hindi ganun yun. No? They are on their own phase or stage, no, of the cycle. And when the next growth stage begins for a particular hair, a new hair is formed and the old hair falls out. That is the reason why, no, falling hair or hair fall is normal. It just means that, okay, the hair is already transitioning into the next growth stage. But you have to remember, no, ah, hair fall is normal as long as it is not noticeable. No, you don't notice it. Meaning, no, oh, okay, hindi ka dapat nakakita ng maraming bungkus ng buhok, for example, in your shower drain. Or upon waking up in the morning, yung maraming buhok sa unan. Because again, no, yung hair fall that is due to the normal transitioning of the growth stage of our hair should go unnoticeable. Oh, kapag napapansin mo na siya, no, there must be something, no, that causing your hair to fall excessively. It might be those products, no, that you put into your hair, o kaya naman, stress is number one cause also, or it can be in your genes, no, sa genetics. Okay. Now, each stage, no, depends on the individual hair. Kaya mapapansin nyo, mayroong mga buhok sa katawan natin, mabagal humaba. There are also hairs na mabilis. Like for example, our hair in the scalp. Yun ang pinakamabilis eh. Oh, take for example your eyelashes. Di ba? Bakit ang eyelashes? You might be wondering why they grow slower as compared to our scalp hair. Because eyelashes have longer resting stage than their growth stage. The growth stage is only 30 days, while the resting stage is 105 days. While in your scalp hair, they have longer growing stage as compared to their resting stage. 3 years for growth stage and 1 to 2 years for resting stage. And that is the reason why scalp hair grows faster than our eyelashes and other hairs in the body. And just like in the color of our skin, wherein one of the determinants of the color is melanin, in our hair, it is also melanin that determines your hair color. And as we grow old, the amount of melanin, the amount of melanin in the hair decreases, causing the hair to become faded. Kaya nagkakaroon ng, kung tawagin nila, silver or gray hair or white hair. Kasi kulang na sa melanin. Okay. No. Ngayon, another accessory feature of our skin is that each of those hair follicle, ayan ang hair follicle, has an associated smooth muscle attached into it. And this is called your arrector pili muscle. In other textbooks, it's called erector pili muscle. Pareho lang yun. Arrector or erector. No? So, in other textbook, it starts with letter E. Erector pili muscle. And when this arrector pili muscle, it causes the hair to stand on its end, di ba? And become perpendicular to the skin surface. And because of that, it produces skin bumps on the epidermis. Pag tayo niyang gano'n, nagkakaroon ng bump sa epidermis. Kakaroon tayo ng goosebumps or goose flesh. Di ba? Okay? And that process is called piloerection. Pagka tumayo yung buhok natin, pag tayo kinikilabutan, di ba? Sa Tagalog, okay? The process is called piloerection. No? Okay. Yan. Okay? Ay, teka, single R pala. Wait lang. Purahin natin. That's single R. Correct nyo na lang. Yan. Single R. Piloerection. No? Okay? It's piloerection that causes goosebumps or goose flesh. And it is actually a result of sympathetic, mostly activated by sympathetic response of the body. Example ng mga sympathetic response. O pagka nagpipigil ka ng pupo, di ba? Pinipigil mo yung bowel movement. Di ba? The more that you are holding it, no? The more that you feel that you can no longer hold it, di ba? And the more that you feel your goosebumps or piloerection. Also, when you are too afraid or fear, no, afraid of something, di ba? You also experience piloerection. And another one, if you feel very, very cold, masyado kang nilalamig, nararamdaman mo rin yan, piloerection. So it is due to the contraction of your erector or arrector pili muscle. Huh? Now, aside from the erector pili muscle, no, there are major glands, no, in the skin that is also associated with your hair follicle. And one of those glands is your sebaceous gland. They are so-called sebaceous gland because they produce an oily white substance that is rich in lipids that we call sebum. Yun ang nilalabas niya yung oily substance. No? And the main function of that oily substance is for lubrication of the hair. That's the reason why it is associated with our hair follicle because it lubricates the skin, or rather the skin, the hair. Okay? And it prevents the skin, no, from drying, and it also has some antibacterial properties. Oo. Why are we not noticing it? No? Ba't hindi natin nanonotice yung langis na inilalabas ng sebaceous gland? Sa anit, hindi natin nanonotice. But for those people who have very active sebaceous glands on the face, di ba? Pag hindi sila naghilamos, for example, in the afternoon, you will notice that there are people, no, who became, yung mukha nila nagiging oily na. Di ba? It's because of the activities of the sebaceous gland. No? Okay. So, for those people who have very active sebaceous gland, sometimes when the skin pore, right where the hair protrudes, no? And also the skin pore, right where the sebum comes out, when it became blocked, no, by dust particles, for example, or dirt, di ba? Yung ating sebum can no longer come out, no? When the sebum can no longer come out, sometimes it also accumulates, no? Right where it passes through, na parang sebo talaga. Tumitigas din, no? Yun, it causes now clogging of the skin pores, which leads to yung sinasabi nating pimple, or the medical term for pimple is acne. Yan ngayon yun. Diba? Kaya, kaya yung mga tao na sobrang oily yung face, they actually are at risk, no, of having more acne, no, or pimple. So that is your sebaceous gland. Again, it produces sebum. Now, aside from the sebaceous glands, you also have your sweat glands, no, in our dermis. And as you can see, you will find two types of sweat glands in the dermis. One that is superficially located and one that is deeply located. The first one is called an eccrine sweat gland, and the other one is called an apocrine sweat gland. What is an eccrine sweat gland? These are coiled tubular glands, which has their own sweat pores. They are not associated, in the skin pores where our hair protrudes, may sariling sweat pore ang eccrine glands. And they are more numerous, in every part of the skin, in almost all surfaces of the skin, the forehead, the back, the chest, the forearm, the palms of the hand, and the soles of the feet. And they usually produce sweat that is mainly composed of water and few salts. Oh, kaya medyo maalat, no, ang pawis. Ah, okay? And its main purpose is more on thermoregulation. Pagka tayo mainit ang core temperature of the body, our tendency is to sweat, to perspire in order to dissipate, no, that heat coming from the inside of the body. So that is the main purpose of the eccrine, no, sweat glands. While your apocrine sweat glands naman, ito ay mas malalim. As you can see, it also joins, no, the skin pore, right where the hair protrudes, and is also where the sebum, no, comes out. Ito ang nilalabas niyan, apocrine sweat gland, are thick substances, thick secretions that are rich in organic substances. And these sweat glands are found in the armpits and also in the genitalia. And these glands becomes more active during puberty because they are influenced by sex hormones. And these secretions are generally odorless. But when they are released, no, in large amounts, like for example, no, kapag yun nga, yung mga nagbibinata, nagdadalaga, they are quickly broken down by bacterial action. That's why hygiene is very important. Kailangan laging malinis ang kilikili at saka yung genital area. Kasi kung hindi, yan yung magbibigay ng body odor or amoy. No? Okay? That is why, no, as an individual reaches puberty, a distinct smell, no, of the body, no, already begins to be obvious. Kaya yun yung time na nagsisimula ng gumamit ng deodorant. Nagiging mas conscious, kailangang mas madalas naliligo. Hindi na amoy bata or hindi na amoy baby, sabi nga nila. Because of the presence and the activity of the apocrine sweat glands. Okay. So let us now go, no, to the next accessory structure, no, of our skin, which is our nails. So just like the appearance of the skin, the appearance of the nails can also be used as an effective diagnostic tool. No? Ibig sabihin, pwedeng tingnan din niya ng mga doctors. No? Like for example, in cases for those patients who are suffering from severe cardiopulmonary diseases, kapag ang pasyente is already suffering from a long-standing cardiopulmonary disease, wherein there is a problem in the oxygenation of tissues, the nails can be deformed. No? Okay? So, meron tinatawag na fingernail clubbing, no? Or nail clubbing. You can look it up, no? So Google, hanapin nyo, tingnan nyo kung anong itsura ng nail clubbing. Again, nakikita yan sa mga pasyente na meron ng long-standing cardiopulmonary diseases. Sa kuko, makikita mo agad eh. Lalo na yung mga bata, no, na habang lumalaki may butas sa puso, no? May mga sakit sa puso. So therefore, the oxygenation of the tissues are also affected. They also tend to have nail clubbing. Try to look it up and take a look at the deformity or the distinct characteristics if a person has nail clubbing. Okay? Now, so, okay, so the nail is a thin plate, no, consisting of layers of dead stratum corneum cells that contain a very hard type of keratin. So ibig sabihin, it's modified skin. O ang laman niya mainly stratum corneum, no? Which is also keratinized. Pero no, it's different because the keratin is harder. So therefore, no, yung part of the nail na yan has no blood supply. Now, the visible part of the nail is called the nail body. Basta itong nakikita natin, yung nakasulpot na yan, the visible part is the nail body. Okay? Wait lang. Yan. No? And the part of the nail covered by the skin is the nail root. Ito naman yun, yung natatakpan ng skin natin. Ayan. That part is the nail root. Located under the skin. While the cuticle or the eponychium, saan yun? Ito yan. Yan yung tinatanggal ng mga manicurista. Diba? Ginugupit ng nipper. Nipper nga ba tawag doon? It is, again, part of the stratum corneum that extends onto the nail body. And the root extends distally from the nail matrix. Okay? So, sige. Now, you will also notice that near the nail root, you will find a semilunar, white shape or crescent surface or crescent shape, white structure on the root of the nail. It's called the lunula. Okay. So, yan. So, sabi nga natin kanina, it can be used as a diagnostic tool for specific conditions or diseases. Okay? So, yan. I will leave it to you to read the protective functions of the integumentary system. 6 lahat yan. It will be included in the examination. Okay? Now, there are many sensory receptors that are found in our skin. There are receptors in the epidermis, but there are a lot of receptors in the dermis, which can detect pain, heat, cold, and temperature, cold and pressure. Okay? Now, you have to remember, ang buhok, walang nerve supply yan. So therefore, bakit po natin nararamdaman pag may humahawak sa buhok? Hindi yung buhok mismo ang nakakaramdam noon, but the receptors around the hair follicle, because once the hair moved at nagalaw din yung hair follicle, that movement is detected by the receptors near and around the hair follicle. Okay? Now, anong sabi natin at the beginning, doon sa first part of the discussion? That hair is in hair tuloy, that the skin functions for the production of vitamin D. Okay? May role doon ng sunlight, specifically ultraviolet rays. As UV light strikes our skin, it causes the skin to produce a molecule which is a precursor of vitamin D. And that inactive pa kaya ang tawag sa kanya precursor. And that inactive vitamin D will be carried by the blood. Saan dadali ng blood yan? To the liver, where it is enzymatically converted. Is that already active vitamin D na? Magagamit na ba ng katawan natin yan? Not yet. Because that converted molecules will still be carried to the kidneys, where it is again converted now to the active form of vitamin D. So therefore, those people with kidney problem, like kung may kidney problem, like for example, kidney failure, you will have a problem of in terms of vitamin D production. Diba? Ano ba ang role ng vitamin D? The function of the vitamin D is to stimulate the small intestine to absorb calcium, and phosphate for many body function. Kaya saan ba importante ang calcium and phosphate? Di ba? That's two basic elements that makes our bone, no, strong and hard. Yan ang nagpapatigas sa buto natin eh. So therefore, if you have deficiency in vitamin D, especially in children, it will result to brittle bones, di ba? Condition that we know as, anong tawag doon? Rickets. Di ba? Tawag doon, rickets. No? Oh, okay? Madaling ma-fracture. No? And usually, children with darker skins, no, are prone to rickets. Kasi the darker the skin, the more melanin, the lesser amount of UV light penetrates. Walang masyadong napoproduce na inactive vitamin D. Walang mako-convert si kidney. Kulang ka sa vitamin D. Hindi ka makaka-absorb ng calcium and phosphate. Okay? Now, our skin, no, also plays a vital role in terms of thermoregulation. As you can see in our illustration, okay, no, yung blood flow through the surface of the skin plays an important role in dissipating heat from the core of the body, yung tinatawag nating heat loss. When there is vasodilation, meaning dilation of the blood vessels near the surface of the skin, there is increased heat loss, which happens, no, when we feel hot or when we are in a hot environment. Di ba? Kailangan nating ilabas yung excess heat of the body. But when we are in a cold environment, no, we need to maintain, no, yung temperature of the core temperature of the body. So therefore, in order to avoid excessive heat loss, no, there is constriction of the blood vessels on the surface of the skin. Hindi, ang resulta, it will prevent, no, heat dissipation towards the surface. Now, in terms of excretion, the skin only plays a minor role. Konti lang naman ang nailalabas natin dyan sa pawis, no? Ang major excretion takes place, no, through our kidneys and also through our digestive system. Okay? Yeah. No? And as we have said earlier, the skin can be used as a diagnostic aid. I-mention na rin natin yan sa first part, di ba? Yung cyanosis, which is the bluish discoloration of the skin. That is caused by the decreased oxygen content of the blood. Kaya pagka ganun nangingitim na, oxygen content na ng blood ang pinag-uusapan nun. And it may be an indication of an impaired circulatory or respiratory function. Now, for those patients with with liver problems, such as those patients with viral hepatitis, iba naman ang nagiging skin color, no? Yung yellowish skin color, and that is totally different, no, from the yellowish tint of the skin when you eat a lot of carotene. Sinabi natin sa start na nakukuha sa squash, sa kalabasa, at saka sa carrot. Ito, pati yung kanilang mata naninilaw, no? And that clinical condition is called jaundice. And when we go to our circulatory system, particularly in our blood, we will be discussing why people, no, develop jaundice if they have liver problems. Ano ba yung napupunta doon sa dugo natin at bakit naninilaw tayo? Okay? We will be discussing that pagdating natin sa midterms. So again, the skin can be used as a diagnostic aid. See, it is easily observed, no, by the doctors. Okay? Now let us go to burn injury, and this is our last topic for this discussion. Ah, so when we say burn injury, it can be caused by heat, cold, friction, chemicals, electricity, or radiation. So those are the physical elements that can cause burn injury to our skin. And most of the time, burns are classified according to their depth, meaning, no, yung layers of the skin that is affected. No? Oh. So, although madalas nating marinig yung mga first degree, second degree, and then third degree burn, these are actually layman's term. In the hospital, no, the terminology used, no, for burn classification according to depth is yung partial thickness, no, yung mga full thickness burn, instead of using the first degree, second degree, and third degree. So we will try to compare these terminologies. No? Gagamitin natin yung terminology na yun. Okay? So, when we say partial thickness burn, wait lang. So, when we say partial thickness burn, it means that the involved, no? When we say partial thickness burn, okay? Dalawa yan. Okay? It's either first degree or second degree burn. Okay? Yung partial thickness, no, is also known as superficial burn, no? Wherein yun din yung first degree, wherein only the epidermis is affected. Epidermis lang affected. Pero mapula na yan. Pero masakit din yan. And it is very or exemplified by sunburn, no? When you are exposed, no, to excessive sunlight. For example, nag-swimming ka, nag-gardening ka, no? And they usually heal without scarring in about a week. Makikita mo lang dyan, nagde-desquamate, no? Or yung sa Tagalog parang nagpapalit-balat, because the dead cells on the superficial layer of the epidermis, no, begins to slough off or to shed off. Diba? There is flaky desquamation kapag first degree burn. Again, that's sunburn. Kapag second degree burn, no, under pa rin ng partial thickness. Okay? No. Ibig sabihin, no, affected na pati ang dermis. Malalim. So ibig sabihin, pag dermis ang affected, it can affect all of those structures located in the dermis. Anong pagkakaiba? Paano mo malalaman? How do you know? No, just by examination, no, just by ocular examination, that the depth, no, of the burn is already second degree by the presence of blisters. May paltos na. Mga natatalsi ka ng mantika na didikit sa mainit na kaldero. Pag nagpaltos, that's already second degree burn. Siyempre, it takes longer time to heal. Mas malalim Di ba? And it can even result to scarring. Pwede talagang mag-scar. Pwedeng magpeklat kasi dermis na yung affected. And there are already collagen fibers that were damaged. Kaya magkakaroon ng peklat talaga. Because when collagen fibers are affected, sigurado magpepeklat talaga yan. And lastly, you have your third degree burn, which is yung full thickness burn. Meaning, hanggang saan? Even the subcutaneous tissue. Pati yung taba affected. At itong third degree burn, by the way, no? It can sometimes be painless. Bakit? Because even the nerve endings located here in the dermis are damaged. So in the dermis, no, or the nerve endings on on the dermis are affected. And then therefore, actually hindi lang basta-basta painless, no? No sensation at all when that burn, no, type of burn heals. Pagka hinipo mo yung scar tissue, the scar tissue does not have any sensation. Oh, yun ang pagkakaiba ng first degree, second degree, and third degree burn. And that ends our discussion sa integumentary system. Okay? No? And wait for the final topic for the prelim. I will also be uploading, no, yung topic natin about the skeletal system. Okay?